National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Naturopathic Doctor Jonathan Beatty here, health expert at Nationalnutrition.ca. Many patients come in to see me in my office because they've recently been diagnosed with diabetes and they want to do something about it. And today we're going to teach you some of the strategies you can do to naturally help manage your diabetes. Now, when I speak about diabetes today, we're specifically going to be talking about type 2 diabetes mellitus. Diabetes is actually short for diabetes mellitus. There's a couple of different types of diabetes that you can have. There's also something called diabetes insipidus. But for today, when we speak diabetes, we're talking about type 2 diabetes mellitus. That's a little bit different than the type 1 version, which is used to be called insulin-dependent diabetes. That being said, just because today's focus is not the type 1 version doesn't mean that some of the information I give out will not be helpful and applicable to those people. So if you are a type 1 and you're a little disappointed that the focus is type 2, please keep listening because there's a few strategies and a few things you can do to help improve your health and limit some of the comorbidities that come with diabetes. Diabetes is essentially a level of, in the type 2 version, insulin resistance. In the type 1 version, it's an inability to produce insulin. Either way, it results in impaired blood sugar control, often determining or causing elevations in blood sugar. The reason this is problematic is that elevated blood sugar then binds to proteins in the body, damaging them. It's actually one of the leading causes of blindness in North America is related to diabetes because the sugars actually get into the eye, they get transformed into a different chemical called sorbitol, which can't be removed from the eye. This causes the eye to swell a little bit, pinches off the nerve, and causes a reduction in vision. It's also one of the major causes of heart disease because the elevated sugars in the blood stick to the outside of the arteries, causing them to harden, causing the development of arterial and atherosclerosis, which can then lead to heart attack. It's also one of the leading causes of amputation. Those elevated sugars also stick to nerves, causing those nerves not to function. What happens is you get decreased feeling and sensation in the extremities, typically in the hands and feet. Why this is problematic is you may stub your toe, not realizing where it is in space, and develop an infection that you can't feel. And if that infection gets too severe, it can actually cause amputation, loss of toe, loss of a foot, even right up to loss of the lower leg up to the knee is actually surprisingly quite common in diabetics. The other problem is that those infections are very difficult to treat. And the reason for that is that infections thrive off of sugar. The bacteria that's creating the infection, it needs that sugar just as much as you do. And when you have elevated blood sugars, you basically have that sugar in abundance. So you're able to really feed that infection, and the infection grows a lot faster and more severely than a typical infection will. So that's why it's so harmful if you do have diabetes. There's a lot of what we call these comorbidities. The diabetes is characterized by the elevated blood sugar, but it's the negative impact that that elevated sugar has that is so problematic. And so some of the things we want to do is we want to increase our body's sensitivity again to insulin. This can also be helpful for the type 1 diabetics, and the reason for that is it can actually reduce the amount of insulin they need to take in a day because of course you're increasing your body's ability to respond to it, so you have to use less. Also very important in type 2 because essentially type 2 diabetes is just insulin resistance. So increasing your body's sensitivity will ultimately lower, and in some cases you can actually eliminate your type 2 diabetes. What that is you can restore the normal sensitivity of your body to your insulin, restoring normal blood sugar control, and you can actually make that diagnosis go away. I see it in my practice all the time. It just takes some significant lifestyle changes, but often nothing too difficult. You just have to be consistent with it. And for that, what we want to do is we want to balance out our blood sugars. The easiest way to do that is through our diet. That's where, that's the source of the sugars in the first place. Now, when we talk about sugar, There's a bunch of different ways people talk about it. They like to talk about simple and complex sugars. You know, diabetics get well versed in something called glycemic index, which is how quickly a sugar is absorbed into the system, as well as something called glycemic load, which is a combination of how quickly the sugar is absorbed, you know, multiplied essentially by how much sugar there is in the product. For instance, watermelon has a low glycemic load, even though it has a very high glycemic index. Watermelon is just water. You know, although the sugars in it are very quickly absorbed, there's not a lot of sugar to begin with, so the overall glycemic load is quite reduced. On the flip side, something like, say, a whole grain bagel, it might have a lower glycemic index, but it actually has quite a high glycemic load because there's so much sugar, there's so much carbohydrate in that product that can actually cause more damage to the blood sugar than something with this high, or more damage as far as insulin resistance than something like, say, watermelon that has a higher glycemic index or a more absorbed sugar. That being said, the way I like to think about sugars is what I call cellular and acellular. When you have a sugar or a starch still contained within the cell, typically it tends to be slower absorbed and more easily utilized by the body. Whereas when you have acellular sugars, that's when you've basically processed the starches out of the cell. They're very rapidly absorbed by the body and they cause rapid and sustained elevations in blood sugar. So it's the difference between, say, eating a sweet potato and eating, say, sweet potato starch. You know, in one case, you know, the sweet potato, the overall amount of sugar is the same. The type of sugar is the same. That being said, the sweet potato is going to cause a much lower rise in blood sugar, and then, say, the sweet potato starch is going to, even though, you know, dosage would be the same. And it's because the starches, when they're contained still within the cell, are harder for your body to liberate, harder for your body to absorb, and therefore, you know, even though you'll take in the same amount of sugar, you'll do it over a much slower time, and that gives your body time to respond appropriately with insulin, and that prevents that resistance from developing. Other things you can do, sometimes nutrient deficiencies are associated with insulin resistance. Probably the biggest one, the most important one to consider is chromium. Chromium is needed for your cells to respond to insulin. So if you have inadequate chromium in your diet, your cells don't have one of the tools they need to respond to the insulin. You know, therefore, if they don't have it, they can't listen. It's like, you know, if you're trying to call somebody without a phone, you know, you can call and call and call. They're just not going to listen. They don't have the tool needed. They don't have a phone on their end to answer. It's the exact same thing. So if you don't have adequate chromium, your cells cannot answer the call or not answer the signal from insulin, and therefore you're going to develop insulin resistance. So chromium can be very helpful. Often I like to pair it with vanadium. Vanadium is another mineral, again, involved in the insulin response within the cell. So combining chromium and vanadium can be very, very helpful in ensuring that the cells are capable of normal blood sugar responses. There are also a few herbs that you can use to help manage your blood sugar. One of the most important ones that I like is called bitter melon, or Momordica charantia. And sometimes there's a variety of different names for it. It's very popular in the diets of West Indian and East Indian culture. And so for that, it's sometimes called Karani or Karaili. I've heard a variety of different names for it. But this vegetable essentially is very good at stimulating normal insulin responses. And so I often prescribe this to my patients. Another herb I really like for insulin resistance is called holy basil or Tulasi. The Latin name is Oxymum sanctum, and this herb also very good at helping to stabilize blood sugars. And lastly is one called cinnamon Cassia. Now, most people, when they're using cinnamon at home, they usually have the cinnamon japonicum, which is the wrong version. What you really want to ensure you're taking, if you're taking cinnamon for diabetes and for blood sugar management, make sure you get cinnamon Cassia. And the reason for that is that's the active one. That's the one all the research has been done on. And that's the one that has the proper active ingredients in the cinnamon to get this effect. And typically you only need to take about a half a teaspoon of cinnamon twice a day for it to have a positive benefit on your blood sugar. But again, making sure you're taking cinnamon Cassia. If you have diabetes, another thing you want to focus on is exercise. See, cells that are insulin resistant have trouble uptaking sugar. The neat thing is that when you exercise, you do two things. First, you actually allow those cells to uptake glucose in the absence of insulin. So an active cell, a muscle cell that's exercising, doesn't actually need insulin to be able to absorb the sugar. So this helps your body to regulate your blood sugars even if they can't listen to the insulin. Another thing it does though is it actually increases your cell's insulin sensitivity. So even at rest, your body becomes better capable of managing your blood glucose and preventing those elevations that we associate with diabetes. So these are some of the things you can do to help regulate your blood sugars and ensure that you don't develop any of the comorbidities of diabetes. And again, make sure you manage your diabetes through diet, exercise, and if need be, if that's not enough, consider taking some supplements to help improve your body's sensitivity to insulin. Check out more of our natural health videos, subscribe, and if you have any questions or comments, post them below. And always remember, knowledge is health.